Today we will assess the musculoskeletal system. First, observe the posture. Also observe client's posture while sitting. Next, observe the gait. The arm swing. Next, the foot position. Inspect and palpate the TMG or temporomandibular joint. Move the jaw from side to side. Protrude or push out and retract or pull in the jaw. Test ROM, ask the client to open the mouth and move the jaw laterally against resistance. With client sitting, inspect the sternoclavicular joint. Next, observe the cervical, thoracic, and lumbar curves. And next, palpate the sphenoid process and the paravertebral muscles. And test ROM of the cervical spine. Then test lateral bending. Also evaluate the rotation as the client to turn the head to the right and left. Test ROM of the lumbar spine as the client to bend forward and ask the client to bend sideways, lateral bending. Test for back and leg pain. And then measure the leg length. In shoulders and arms, inspect and palpate. Ask the client to stand with both arms straight down at the sides. Next, ask the client to move the arms forward, then backward with elbows straight. Then have the client bring both hands together over head, elbows straight, followed by moving both hands in front of the body. Motion, have the client bring the hands together behind the head with elbows flexed. In elbows, inspect for size, shape, deformities, redness, or swelling. Next, test ROM and flex the elbow. Then hold arm out. In wrist, inspect size, shape, symmetry, color, and swelling. And next, perform the squeeze test. And next, I'm palpating the anatomic shop box. Test ROM, ask the client to bend the wrist down and back. Next, have the client hold the wrist straight and move the hand outward and inward. Test for carpal tunnel syndrome. Then perform Pallen test and the Tinel test. Observe for the flick signal. Test for thumb weakness. In hands and fingers, inspect of size, shape, symmetry, swelling, and color. Ask the client to spread the fingers apart. Make a fist. Bend the fingers down and then up. Move the thumb away from other fingers. And then touch the thumb to the base of the small finger. In hips, with the client is standing, inspect symmetry and shape of the hips. Test ROM. With the client supine, ask the client to raise extended leg. Flex knee up to chest while keeping other leg extended. Move extended leg. Bend knee and turn leg. The client to lie prone and lift extended leg off table. In knees, inspect for size, shape, symmetry, swelling, deformities, and alignment. Palpate for tenderness, warmth, consistency, and nodules. Then, perform the bulge test if swelling is present. Then, press on the lateral side of the knee and look for a bulge of the medial side of the knee. Perform the ballottement test. Test ROM, bend each knee. Test for pain and injury. In ankles and feet, inspect position, alignment, shape, and skin. Then, palpate ankles and feet for tenderness, heat, swelling, or nodules. Then, perform the squeeze test by squeezing the middle of the foot with your hand across top of foot as shown. Test ROM as the client toes upward and then downward. Turn soles outward and then inward. Rotate foot outward and then inward.